I think the difficulty with coming to a maternal fetal medicine specialist is the idea that you're going to get bad news. And I think allowing that absorption of the whole picture is really important because it's news. It's not bad news, it's about your baby. The maternal fetal medicine specialist is part of the team, and usually that is still led by the obstetrician. The obstetrician has taken the care and the time to send you for the referral. And this is important because we want to maintain a similar picture, we want to have unified goals, and we want to have the best possible outcome. What I do as a maternal fetal medicine specialist is I see people that probably need additional care even before their pregnancy. And some of these patients actually have diabetes, hypertension, have had recurrent loss, an early delivery. You may not have a whole lot of warning that you might need to see a high-risk maternal fetal medicine specialist until there's something that comes up in the pregnancy. Maybe your water broke at 27 weeks. Maybe your baby has an ultrasound finding that's concerning for an abnormality that needs to be further delineated, and the baby itself may need extra care at the time of delivery. A lot of times with an initial consultation, we will meet and have a greater amount of time to really sit down and talk about certain genetic conditions or have you meet with a geneticist. We also may have then a high-risk team, including a nurse practitioner, and a maternal fetal medicine specialist that does additional questioning, as well as an ultrasound. And then after the ultrasound, there's a discussion about the next steps. Sometimes what'll happen is during the ultrasound, images will come up and discussion may ensue between the sonographer and the patient. And then the ultrasounds images, including cine clips, which are clips that are active, are then reviewed with the specialist. There may be challenging decisions and or discussions that come up surrounding the family and the baby, but know that this is just the beginning, and it's not that any absolute answers have to be decided with an initial consultation. We also in our office have a psychologist that can help, and also palliative care and or people that come into play for some of these unanticipated outcomes that may require a life that may not be as long after the baby's born. The other thing that can come up with a complicated pregnancy is the need to be admitted to the hospital. And long-term admission is always a possibility with certain conditions. It's difficult to predict if this is going to happen and when this is happening. It also would include the care of a neonatologist and the team that then supports the baby after birth in the neonatal intensive care unit.